I ngā taumata whakarongo, I ngā rauru o te motu, tēnā tātou o roto I ngā āhuatanga o te wā. Ko tēnei te wiki o te reo Māori, nō reira, kia kaha te kōrero Māori I ngā wā katoa, ka tupu, ka ora, ka tū, ka ia. Tēnā tātou katoa. Good afternoon, everyone. I want to begin by acknowledging Te Wiki o Te Reo Māori, Māori Language Week, a chance for us to celebrate Te Reo Māori. As you will have seen earlier, today there are 33 new community cases to report, all of which are in the Auckland region. While this is a high number, it's important to note that only one case is currently not yet linked to our known clusters. So virtually all of them are, in a way, expected cases, including, for example, 7 in just one household. Likewise, of the cases reported yesterday, just 1 remains unlinked to the wider outbreak at this point. And that is one of the hard things about Delta. Every time we get a new case, if that person's family members don't already have the virus, they are likely to get it in due course. That means numbers do and are rumbling along, and this has been evident in the last 3 days. This doesn't mean that our collective efforts in Auckland are not making a difference. Testing rates have been very good across the last week, especially in suburbs that our testing teams have targeted. So huge thanks to people in Mangere, Manurewa, Papatoetoe, Otara, Henderson and Massey, among others, who've done their bit and been tested, even if asymptomatic. Likewise, our surveillance testing of healthcare workers and essential workers has not identified any transmission, which helps give us increasing confidence that control measures are working. It's also clear there is not widespread transmission of the virus in Auckland. I'll repeat that again. It is also clear there is not widespread transmission of the virus in Auckland. But as we outlined yesterday, there are 2 key features of recent cases that are of the most interest. 1, we still have roughly 3 clusters that continue to produce cases, not in an uncontrolled way, but so long as we have cases emerging, there are risks. 2, the ongoing emergence of cases that are at least initially a mystery, or what we often refer to as unlinked. The number of these cases is not large. In fact, as of today, I can report that of all the cases reported in the last 2 weeks, only 17 remain unlinked. And of those, only a handful have been highlighted by our public health team to be of particular concern. So that's really positive. But mystery cases are still coming through. And the fact that we are finding them through surveillance and community testing rather than through contact tracing, that is what we're concerned about, because that does present risk. It means that those cases, until we find them, are out and about in the community and may be the source of other cases, or themselves have been sourced through cases we don't yet know about. And so that leaves us 2 very clear tasks ahead. The first is to continue with what we call active cluster management. That's the job our public health team are doing and are working day and night on. The second is more surveillance and community-based testing, and I'll talk a bit more about that soon. But there is one extra tool that continues to support our efforts to stamp out Delta, and that is the use of restrictions. Cabinet met today to consider the role that Level 4 has played to date and what role it can continue to play at this stage of the outbreak. We also discussed the settings for the rest of the country. What we saw in terms of evidence and advice is that Alert Level 4 is working. The start of the outbreak, the R value of the virus was 6 or higher, meaning 1 infected person was likely to pass the virus on to 6 others. Alert Level 4 has reduced the R value down to consistently below 1. It has helped us get the outbreak under control. But as you will have seen in the last few days, we haven't quite finished the job yet. Level 4 remains our best option to beat Delta and contain the virus at this stage of the outbreak. And we don't want to risk the sacrifices everyone has made and all the hard work you've put in by moving to Alert Level 3 too quickly. On that basis, and on the advice of the Director General of Health, Cabinet has agreed that Auckland will remain at level 4 until 11:59 p.m. next Tuesday, the 21st of September. Cabinet has made an in-principle decision that Auckland will at that point move to alert level 3. We will continue with weekly reviews at Cabinet to confirm these indicative settings, but we wanted to give people a sense of our direction of travel. That then brings me to the rest of New Zealand. I know that for many, the risk of the rest of the country may feel low. While it's true that there's nothing to indicate that there is COVID anywhere outside of Auckland, there is still reason to be cautious. If COVID were to travel over the Auckland border, the impact of that happening in a level 1 environment would be far greater than if a case emerged in a level 2 environment. It would mean far greater chance of spread if it were level 1 and a far greater chance of a return to lockdowns. Nobody wants that. It's for that reason that the Director General has recommended and Cabinet has agreed that the rest of New Zealand will remain at alert level 2 until Tuesday the 21st of September. Cabinet will review these settings next Monday also.